Hello everyone, I'm Dr. Rakhee, a consultant paediatrician. Have you ever heard of the meningococcal disease? If you're a Muslim and have performed Hajj or Umrah, you may have taken the meningococcal vaccine before. But what do you know about the disease? Let's learn more as I answer some questions on meningococcal disease in this video. Meningococcal disease is caused by Neisseria meningitidis, a species of bacteria more commonly known as meningococcus. There are 6 types of Neisseria meningitidis that cause most cases worldwide. These are serogroups A, B, C, W, X, Y. It is estimated that 1 in 10 people have these bacteria in their nose and throat without being sick and can be considered as carriers. Meningococcus spreads to other people via respiratory droplets, for example, coughs or sneezes of an infected person. Generally, it takes prolonged or close contact to spread these bacteria. Fortunately, they're not as contagious as germs that cause the common cold or influenza. The disease is most common in children younger than 5 years, especially children younger than 1 year. Other populations that are at high risk of contracting this disease include young adults aged 16 to 21 years and elderly aged 65 years and older. Meningococcal disease and meningitis are related, but they're not the same thing. Meningococcal disease refers to any illness caused by Neisseria meningitidis or meningococcus. These illnesses include meningitis and septicemia, both of which can be very severe. On the other hand, meningitis refers to an inflammation of the meninges, the lining of the brain and spinal cord. Meningitis is caused by an infection with viruses, bacteria, and parasites. Bacterial meningitis is very serious and requires medical attention as soon as possible. Neisseria meningitidis is one of the most common causes of bacterial meningitis other than streptococcal pneumonia and Haemophilus influenza type B. Symptoms depend on the type of infections. The 2 most common types of meningococcal infections are meningitis and septicemia. Some symptoms of meningococcal meningitis include fever, headache, stiff neck, nausea, vomiting, and sensitivity to light. For meningococcal septicemia, symptoms include fever, chills, fatigue, vomiting, cold hands and feet, severe muscle, joint, chest aches, rapid breathing, diarrhea, and the development of dark purple rashes. Complications due to meningococcal disease can be devastating. Even with antibiotic treatment, 10 to 15 in 100 people with meningococcal disease will die. Furthermore, up to 1 in 5 survivors will have long-term disabilities such as loss of limbs, deafness, nervous system problems, brain damage, and learning disabilities. Meningococcal disease is very serious and can lead to death in a matter of hours. This is why early diagnosis and treatment are very important. Meningococcal infections can be prevented by taking basic hygiene measures and maintaining healthy habits such as washing hands frequently, wearing a mask, getting adequate rest, and avoiding close contact with sick individuals. Nevertheless, vaccination is the best prevention against meningococcal infections. Several types of vaccines are available. Polysaccharide vaccines are available as bivalent, trivalent, or tetravalent vaccines. They offer protection for up to 3 years and are not effective for children under 2 years old. Conjugate vaccines are available as monovalent or tetravalent vaccines. These vaccines confer longer-lasting immunity for 5 years or longer and can be given to children as young as 2 months old, depending on the type of vaccine. Recombinant protein vaccines are the latest meningococcal vaccine to be introduced and are not widely available yet. Consult your doctor to know the suitable type of vaccine and the appropriate timing to get your children and yourself vaccinated. Another preventive step is to give antibiotics promptly as a prophylaxis after being in close contact with a meningococcal meningitis patient. This can decrease the risk of transmission. Various groups of people are required or recommended to get the meningococcal vaccine. For example, Hajj or Umrah pilgrims are required by the Saudi government to get vaccinated against meningococcus before arriving. By doing this, pilgrims not only protect themselves but also other family members once they return from their pilgrimages. Additionally, travelers or residents in countries where meningococcal disease is hyper-endemic or epidemic are highly recommended to get the vaccine. These countries include countries in the meningitis belt of sub-Saharan Africa, like Senegal, Ghana, and Cameroon. Other groups recommended to get the vaccine are individuals with certain medical conditions like HIV infection, people living in close quarters like college students or army recruits, people at risk due to meningococcal disease outbreak, as well as individuals working with meningococcus bacteria in labs. Preterm babies may also be vaccinated during infancy for extra protection. Hope that answers some of the questions that you may have on meningococcal disease. To learn more about vaccination, child health, and related topics, please visit the Positive Parenting website, as well as our social media pages on Facebook and Instagram. Thank you for watching.